Good morning. Welcome to EduSet Network. Friend, you know this week we have organized series of lectures on social work, and in the last lecture we tried to understand method of working with group. Today we will try to understand the method of working with individual and social case work. This is an important aspect of any course of the university curriculum which is framed, and we need to try how to work with individuals, that is methods of working with individuals. And for discussion on this very topic, we have in studio eminent academician, educator, trainer, Dr. Sanjay Bhatt. He is presently a professor of social work in the Department of Social Work in University of Delhi, and has long experience in working with the different social groups, and have visited in different calamity affected areas. So he has got a practical exposure to various part of the country, so how the people are working and there. And he is also a member of different academic bodies and member of the committees of universities and institution of repute. He has published a number of papers in the national and international journals, and presented a large number of papers in conferences, and raised the voice of the marginalized section of the society. And Dr. Bhatt is also his credit goes to publishing 3 books. One is the Practicing Social Work, and the other is Social Work Responsible and Social Responsibility. So I think his knowledge and wide experience will help us to understand this topic and give insight. So on your behalf, I welcome Professor Sanjay Bhatt for the EduSet lecture on this very topic. Welcome, sir.
Thank you. Social work is a practice-oriented subject, and normally people understand by social work mean what anybody can do for the society. But here, what the social work we are talking the social work, professional social work, which has been done by the trained people, those who have been taught how to work with the people. And working with people is an art. Whether we work with the people at individual level, or we work at the group level, or we work at the community level. So there are 3 levels on which we work with the individuals, and this generates the 3 methods, distinct methods of working with people. While we say working with individuals, the method is known as social casework. When we say working with groups, we call the named is social group work. And when we call working with the communities, the method is known as community organization. And these are 3 distinct methods which has been evolved after years practice and theoretical research by the social work professionals, and they are being used for the betterment of the individuals or group or society. Social work is basically scientific knowledge, and it is a scientific knowledge with the skills in human relations. So how to make the human relations better? That's what one of the objective of the social work. And of course, social work is humanitarian in approach, but at the same time, it is a problem-oriented approach, problem-solving approach to the people. And while we are talking of the problem-solving, the third common base of social work practice is that it improves the social functioning of the people with respect to their needs, with respect to their problems, roles, responsibilities, capacities. And fourth common base of the social work is that it promotes social change, the changing situation. So it responds to the changes in the society, and it sometimes challenges the responses which is coming out of this change. Now, today we will be discussing and focusing our discussion only on the one method, what we call social work, social casework, working with individual. Now, if we look at the casework, the design of casework, the development of the casework method, can we look back when the social work has started emerging as a professional social worker? By and large, is developed in early 1910, 1912. In the UK and USA, where the approach was, when the experiment was going on with the development of the friendly visitors, and a movement what we call charity organization society how to organize the charity for poor people, and in that process a idea came that we should have the friendly visitor who goes to the community, so find out the conditions of the poor, and they come out with a kind of investigative report whether the person is deserving help or not through church. Same as there is a movement called settlement house movement, and the university students were working with the poor areas, with the poor people in the slums and ghettos. They also realized that there is a need to find out more and more about the poor people, and in that process this method start gaining ground. And soon after, the psychoanalytical tradition developed by the Freudian psychology and by Freud and his associates has largely influenced this process. So social casework is a powerful method. It is an art of applying knowledge of human behavior in order to solve the problem and to bring the adjustment of person with the environment. So in that process, if we look at that, it intends for the internal well-being of individual, and at the same time it takes care of interpersonal and intrapersonal problem of the individual. If you look at today, in the today's society, every person is either infected, either suffering with the interpersonal problem or intrapersonal problem, problem of relationship. In fact, we are in a society where we are living with the problems of relationship at individual level, with the groups, with the people, those who are around us, all kind. And as a consequential impact of this failure of the relationship, we are seeing many problems: stress, suicide, breakup, family breakup, divorce, deceit, number of problems which are coming up, even including drug addiction. So in that light, if we look at the social casework is a problem solving approach, and it becomes very important in today's context. Now if we look at what we are missing, today's modern men in this most industrialized society, which is fast running society where nobody has time for no one, we are missing our expected social functioning. What is the expected social role? That we miss number of time, and out of that we create many problems. Sometime what happens that if you look at the need problem paradigm, need when are unmet or unrealistic, they convert problem. I don't have a need of a car, but when I presume unrealistically, though I need a Audi, then what happens that it start turning out to be in a problem, because need has to go in consonance with my availability of the resources, and I don't have resources. So what happens? It start disturbing the social adjustment, the entire social adjustment in and around me, between me and my family, between me and my job, between me and my people. It start disturbing. So need when unmet or sometime unrealistic or not visualized properly, they turn out to be the problem, and problem in turn affects our social roles, and when the social roles are not performed, it affects our social functioning, and when social functioning is affected, it turn out into the problems and consequential impact. So social casework is very important because it helps in improving the social functioning, and in other words, if I say that it helps us in strengthening the decision making process in day-to-day life with respect to the needs and problems. Psychoanalytical tradition, people call it ego strengthening. Now the relationship is the crux, and relationship is that transmission belt through which you give someone the help. So when we talk in social casework, we talk in social casework as the professional help. There are two kinds of relationships: social relationship and professional relationship. Social relationships are wide, open-ended, unlimited, without much of expectations or undefined expectations. When we talk of professional help or professional relationship is intended with some kind of a goal, some kind of a purpose, and it has the fixed dimension, it has the where it has to operate, and that is what very important. Now, how to make the relationship is another issue, because if we have to help someone, we have to develop a rapport with him. Rapport building is very essential. So relationship is a transmission belt through which the professional help goes to a person. If suppose somebody is in depression, you can't go and tell him that, look, you should not be in depression, depression is bad and all that. First of all, you have to develop a workable relationship, a rapport with the person. And for developing this rapport, this relationship, which gives you the space for interaction, there are certain principles of making relationship, what F.B. Bistec has defined, and there are simple principles. These can be applied in day-to-day life also, but we don't apply because we don't understand the gravity of these principles. Quickly I tell you, these are the 7 principles which Bistec have propounded, and I have a little bit modification to that. The first principle is individualization. Individualization means that every person is unique, every person has its own characteristics, every person has its own socialization, the way of looking at the problem, the perspective. So no two persons are alike. I mean, we may think alike, but physiologically if you look at, no two persons are alike. Even the twins, they look identical in appearance, they have a different personality shape. So believe me that the first principle of relationship is that every person is unique, and social casework starts with this, that there is a uniqueness of individual. When we have to make the relationship, there should be purposeful expression of feelings, emotions, ideas, exchange. The third is that develop a professional relationship, the emotions should not travel. I don't mean to say that there should not be emotions. Without emotions there will not be a relationship, but controlled emotions. That will make a relationship, that will make a professional relationship, because remember, you are making this relationship to help the other person. If he is sad, if he is infected with his problem, if he is beeping and you also start sympathizing with him, nothing wrong in sympathy, but then you lose the track where the problem originates. So the relationship should be empathetic, not sympathetic. So empathy is more important. The other problem in relationship is, whenever we meet someone, how do we react? We react with his presence, appearance, with his color, with his style, manners, and we immediately start forming certain opinions. For good professional relationship, there should be non-judgmental attitude. Take time. Don't judge the person immediately. And the moment you make an opinion about a person, it will create some kind of a block in making rapport and also in helping the people. So the fifth principle is non-judgmental. Now, when we try to help someone, we are always dominated by an idea that we are giver. Somebody came to me for a help and I am on somewhat superposition, I am helping that person, I am doing something for him, I am, and this I makes you so distinct and different that you lose the focus. Remember, the person who came for help, he also have a right to self-determine what is best for him. So no imposition, it has to be participatory. You have to explain that yes, your problem can be solved in such and such way. Rather than you say, no, this is my prescription and I prescribe this medicine to you, and prescriptive operation will not work. In any social problem or in any individual problem, prescription doesn't work, and that's what the malady. Most of the counselors, they prescribe. Teachers, they prescribe for a student. So the prescription, not prescription, but more participation. And last but not least, everybody want to protect his dignity, want to remain, want to have help, but without offending it. So what it requires? It required confidentiality. Somebody came for help and he only will open up with you when he gets surety that you are keeping this information up to yourself. So making a relationship, these are some important principles when we make. You can apply it in your day-to-day life also, and look at when you apply these, your relationship gets more stronger, more strengthened. When we talk of the thoughts of social casework, as I told you that in the early days, the Freudian psychoanalytical tradition and psychological theories, they dominated social casework. And there was a school which called psychoanalytical, a school of thought, and later on another school of thought came which called functional school by Otto Rank. Now the psychoanalytical school or diagnostic school of casework, which is called in a way, it depends on the conceptual framework of the Freud, which says id, ego and superego. So how to strengthen the ego of a person so that he is able to take the proper decision, and thereby he will be able to solve the problem. That's mean all the problems are in and around in psychoanalytical traditions on the unconscious mind, and how to control that and how to rectify that, that psychoanalytical tradition speaks out. While Otto Rank, the functional school, was talking of the making more will, free release, and making the will more important. So these two traditions with the social casework started, and it has gained the ground in next 20-25 years. By the 50s and 60s, the social casework was established in many areas, especially in child guidance centers. It was established in medical and psychiatric centers. It was helpful in getting the treatment of the stressed people. It was very helpful in getting the treatment of the disturbed relationship. It was very useful where it has been applied into the first phase with the discords and disturbance and maladjustment, or you may call it maladaptive behavior. Now with this, if we go a little bit ahead, the Perlman, Henry Perlman, gave the 4 P's of social casework. This says there are 4 P important: person, problem, place and process. Person means the individual who is infected with a problem, come to a place. That's in social casework we call a word agency. Agency means the place from where the social services or the social help is being delivered by a trained professional social workers, and process is obviously how it is being done. So these 4 P's have been explained by the Perlman. When you will read, you will find it in more detail. Now these 4 P's are important in the terms that you understand the person, you understand the problem, you understand the place where you are delivering it, and you understand the processes. Now if I go a little bit ahead, when we talk of the processes are divided into the 3 steps, and this is the psychosocial study, studying the problem, studying the person and environment, and finding out why there is a problem. So this psychosocial study, then on the basis of the facts or data gathered under the psychosocial study, the diagnosis is being framed, what it called social diagnosis. And on the basis of a diagnosis, a treatment plan is prepared. Now these terms look like more closer to the medical terminology drawn. So I told you that at the first stage, of the social casework. These terms have been borrowed from the medical terminology and applied into the correction of the human behavior or resolving the problems of the human being, which they are surrounded by many behavioral problems, which originates either interpersonally because of your own thinking, own cognitive way of looking at the thing, own perspective, or either influenced by the intrapersonal mechanism being initiated by the outside stressor in the environment. Now, many authors have renamed these processes also. Now, some is called intake and then study. Instead of diagnosis, people have started using the term assessment, and after the assessment is what the treatment, which we called is the intervention, and finally the fifth term which is being coined out, that what we call termination. So this says that professional help is to be given where you accept a person, and interestingly I tell you, this person in social casework is called client. So I mean, this is what 1920s vocabulary, client. Client means a person who came for help to you. So this vocabulary probably was very limited availability of the medical vocabulary and legal vocabulary, so they have drawn their component. Now here again this client has been replaced by many other words like beneficiaries, like the person who's getting the service. When I just finish it here with the processes, I must tell you that there are many psychologists and many theorists who have contributed to understanding of the human behavior, and that understanding has been inculcated in social casework practice either at diagnosis level or at treatment level or at even studying level. So all three levels, the knowledge of human behavior which came from the social psychology or which came from the abnormal psychology or even from the psychology and also from the sociology, like when we talk of the social psychology, like understanding living in the groups and relationship, like Slabson has explained it, even Gestalt theory, they all came together to give a jumping ground to the social casework. For example, Kurt Lewin's psychological and physical interaction of environment, he came out with a kind of life space, and then he mathematically says that behavior is a function of life space, and life space is a application of physical and psychological and environmental conditions. Similarly, many other people, they have come up and they try to explain the process of making a study, how to make the study. Now, a study is to be made on the basis of the interaction with the client, and the biggest form comes out the interviewing. And observation is another big tool to observe the people, because communication which is verbal or written, apart from that, there is a lot of non-verbal communications. So while you are trying to understand the problem of a client or problem of a person, you should be good enough in understanding the non-verbal side of the communication. That's body language. Somebody is not able to communicate you verbally, but by body language, the client is communicating to you that I am in a deep trouble. You know, the emotions, the facial expressions, these all becomes very important in understanding the interviewing process, how to do it. And here I will not undermine to tell you one very important area, that is what we call ego defense mechanism. Freudian psychology have explained it, the defense mechanism, how we defend ourselves to defend our ego. And when we defend our ego, it's not to say anything else, but it speaks about your behavior, the way of looking at things. And in that process, we have many techniques. We have many situations where we defend ourselves. So while helping the people, one has to a good knowledge of the defense mechanism. Now, the whole idea of the interaction, interview and observation is to know more and more about the person who is in a trouble. Why he is in a trouble, what is the nature of problem, or what is the nature of surrounding, whether he is in a trouble because of himself or whether he is in a trouble because of the other factors. This is what very important, and this helps you when you study, this helps you in making a diagnosis. And while making a diagnosis, it is important to understand that there are three kinds of diagnosis: etiological, clinical and dynamic. So sometimes we do clinical diagnosis. I mean, based on the fact, simply I said, okay, you failed in the exam, therefore you are depressed, therefore you want to commit the suicide. May not be that only. There may be many other dynamic component linked with it, many other factors. Maybe even the childhood socialization, childhood experiences. There can be a number of things which associated one particular case. So this is the first part where the social casework. I tried to explain you the meaning, objective, its significance, and also I tried to explain you the relationship, the principles on which social casework work, the basic assumptions on which social casework work, and then how this has grown up and how it has been influenced by the psychoanalytical traditions and psychological theories, to the process which begins with the intake, well, you accept the client or person who is in a problem, to the studying the client, and later on to diagnosing the problem into the different way, and after making diagnosis, when you could settle out that these are the regions for the problem, and there can be multiple regions, because it's not very simple, it's not one to one, it is culmination of factors. You know, some person is sad not because of this that he lost something. This loss may be one point, but there can be many other things attached to it. So while we are making a diagnosis, we have to take a dynamic diagnosis, finding out where is the problem lies. Unfortunately, what we do in day-to-day life also, we do not try to find the root cause of the problem. We see only what visible is to us. We don't go into the deep, because either we are afraid or we don't want to make it. If you look at other way around, many people are happy when they have regions. We are only happy when we have regions. That is why our happiness is momentary. The moment region goes, happiness goes. If we start living with this idea that happiness is an attitude, it should be the part of my day-to-day life, then I don't need a reason to be happy. Same way. So, you know, it's the way we develop our lifestyle, our style of thinking, our style of doing. But I tell you, in the social casework, when a caseworker, social casework is a method, and the one who practice it is by and large called caseworker, but it has also been called with different names as per setting. As per setting, I say, if somebody is working in a child guidance center, he may be called a child caseworker or social worker. If somebody is working in a drug de-addiction center, he may be called a drug de-addiction counselor also. Somebody is working in a psychiatric setting, he may be called a psychiatric social worker. But here I am referring, anyone who is using the method of casework is a caseworker. So caseworker, while he starts the treatment plan, there are large number of therapies available. And to select a particular kind of therapy is very important. It is equally important to know that what kind of therapies one has to use. I will just give you some of the name. It is not in any order, but I will be mentioning these therapies, these style of therapeutic approaches, so that you can have a wide canvas that only problem solving solution or talking of the problem or finding out the nature of problem or making a diagnosis is not. There are options available to help the person, and that's what the treasure of the casework is. Like when we talk of the therapies, there are social or psychoanalytical therapies based on all the Freudian work, and you know that Freud has done remarkable work in understanding the human mind, right from the conception of the id, ego and superego, which has been analyzed by many psychologists in many ways. Even Sudhir Kakkad has analyzed it, id, ego and superego, in with the Indian philosophy. He tried to see it, and there are people who try to find out how id operates and how the want and desires are being controlled by the superego, which is developed by the socialization and by the society, and how ego becomes, compressed in is a balancing power between demand and societal pressure. So Freudian psychology has given many techniques and many approaches, like free association, like dream analysis, like hypnotic trances. Of course, these are being done by the qualified psychiatric people, and social caseworker also uses them when he is quite qualified to do it. These are the approaches and method cannot be used by a layman simply on the basis of its name or its knowledge. I mean, like hypnotic trances, taking a person into the past and trying to find out what goes on the unconscious mind and giving the suggestive remedies and therapies there. It's not an easy joke, and one cannot do it, and one should not try to do it also. This is what I would like to give a legal caution. But when you work as a team in a psychiatric hospital with the psychologist, with the psychoanalyst, with the doctor, with the psychiatrist, you learn these processes and these techniques, how you can. Remember, the casework has been first used in a team, in a group, which the group of doctors, nurses, psychologists, social caseworker, they have been working in a tandem. Slowly and slowly, in some soft areas, caseworker has started working independently, but in some hard areas, still it is a team approach and works with the collaboration of that. The behavior therapy. Not many behavioral therapy, because all what we were talking into the social casework is the adjustment, bringing adjustment back, because maladjustment brings many things. Maladjustment brings many problems. It has a ruptured social functioning. It has a very problematic, lending you into the problematic areas. And problems are also like the onion circle, that once you are landed in one problem, you may be grabbed by the another problem. Suppose a student do not have a fees to pay, and he doesn't share it with anyone, he doesn't fill up the fees at the time, he is not able to appear in the exam. That's not the end. He is not able to appear in the exam, he could not cross the course, now he has no face to show it into the family or into the society. Now he goes into telling the lies to the people that I appeared but the result has been detained. So one problem may start a whirling kind of situation. And when we say adjustment, maladjustment in relationship, the behavioral therapy is one which tries to improve the behavior so that one can understand where it lies. Now, some of the behavioral therapies are classical conditioning, operant conditioning. Eysenck, a very well-known person, Eysenck given the idea of classical conditioning. There is a Wolff who gave the approach of systematic desensitization, how to systematically desensitize and demolish the kind of a concept or perspective which one has developed with respect to its problem. there is a systematic extinction of the problem, and flooding. There is another approach is called flooding. Implosion therapy is another one which used. Aversion therapy, assertive therapy. Like aversion therapy, it's a very important into the cases like drug addiction. How to create distaste for the drugs, or kind of smoking. Many people have, many such habits or such behavior. Sometimes we know that this is dangerous, but still we do that. I mean, writing smoke is injurious to health. Any cigarette smoker is reading it every day, but it's not giving any kind of a punishment or behavioral modification. So information mere is not behavioral modification. It requires the systematic process of changing the set of attitude, the way of looking at it. So number of behavioral therapies are being mentioned. The positive reinforcement, the best, which has been used in the school days by the teacher when some child does a good work and teacher gives 4 stars or 5 stars, and child is positively reinforced. But in day-to-day life, in the working life, how many bosses gives the positive reinforcement to their employees? Since they do not give, there starts the cracking of relationship in a team. Mind it, human mind or human behavior has the 2 very important characteristics in life. One is dominance, that's a human nature, and other is a recognition. Everybody wants recognized. Everybody wants that kind of appreciation. And the moment we forget it, in our day-to-day behavior, in our relationship, the repercussion starts. And they may come in any form. Ignoring, avoiding someone, deliberate ignorance, deliberate avoidance creates a lot of problem to the behavior of other person. It's repelling. It comes out in a very ugly form. Many cases of sexual harassment or others, if you look at the genesis or root cause, if they have killed the root cause at that then and there, the first very day, the things would not happen. Even in field of addiction. So, I mean, positive reinforcement need not to speak that, everybody wants the appreciation or recognition of its work. Positive reinforcement is a technique to change the behavior. If 10 times you tell a person you are doing a good work, even 5th or 6th time he is not doing that good work which you are appreciating, he will be forced to make his behavioral change. That yes, I have to do good work because I have to get this continuous appreciation. Then if I give you some other form of the therapies, like client-centered therapy. Carl Rogers, the founder who came out, he says individual, not the problem, is focus. Problem is not the focus, individual is the focus. So far we were saying we have to focus on the problem, and by attacking on the problem, finding out the causes. So in client-centered therapy we say individual is the focus, not the problem. Feeling rather than intellect is the focus. Present, not the past, is the focus. Whatever has happened, happened. There are many therapies available in our Indian religion also, or in our Indian scriptures. I will come in later on that. So the Carl Rogers client-centered approach, it has worked very well. It has given. I cannot go in detail of each therapy because of the time. So I am just giving you an outline that social caseworker uses these kind of therapies. You can understand that how important it is for the caseworker. Cognitive therapy. Beck, Aaron Beck, who has used the therapy for depression. Or for that saying, Ellis, who has rational emotive therapy. Of course, these all are coming from the psychological background or from the the behavioral science tradition, but they have been adopted and used by the social work people or social case workers into the day-to-day life. If I go little more, when we say of the cognitive part of it, its attention, its judgment, its thought, memories, consciousness, that is the crux where we have to come out. There are many other theories like counseling. Counseling is not only an information giving. Many people say I did counseling. It's not like that. Counseling is in a very specialized way, a specialized approach of helping people, those who are in trouble. All sort of. You require family counselor, you require HIV/AIDS counselor, the person who is affected, who has been declared that you are HIV positive, require counseling. Educational counselor, the one who has to give counseling to a student, what kind of courses you should offer and what kind of courses you should not offer. Counseling is in a very specialized branch, but it has a firm footing as far as the principles are concerned. And Bertha Reynolds first time used counseling in casework. So casework is in a wider approach, and within that she has used the counseling, I believe long back in 1932. So counseling is another very important area. There are many other therapies which have been used. I will name some of them, like Gestalt. Gestalt means whole, complete. I believe Perls had given this. We talk of the unity of mind and body, not to work on one aspect, bring a command between both of them, integration of thought, feeling, action, all that together has to be taken into the consideration while treating somebody who is in a distress or who is in a problem. Existential therapy. So I was just naming these therapies. I no way in this lecture claim that I am giving you information about each therapy completely. It's not possible. Each therapy has more than enough written and done and practiced, which require large number of time and volume. I'm just giving you the idea as a beginner, as a student of the social casework. You should know that these are the part of the social casework therapeutic processes. Psychodrama. I'm not saying that every caseworker has to do psychodrama, but one should know that J.L. Moreno has given the concept of psychodrama and how it has to be used, where it has to be used. And I don't say that caseworker is only responsible for treating the person. He can be the part of a team and he can be the instrumental in doing that. Now I will talk a little bit of the indigenous therapy. Indigenous therapy in the sense that therapies which born out of your own cultural context, Indian context. Biofeed therapies, biofeedback, more medical kind, how to maintain your blood pressure, this, that, But I will try to remind it here that there are many therapies available in Indian scriptures and even in Indian practices. Yoga, pranayam. They are very therapeutic in nature. If you look at it, it is a gestalt. Keep the unity between mind, body and soul. So why a caseworker cannot use it? Nowadays in most of the conferences and big meetings, suddenly the chairperson will announce that for 5 minutes we will have the long breathing exercise just to get physical relaxation. So from that core to the larger core. Many yoga expert claims that physiological or physical diseases can be cured by the yoga, apart from the mental. Behaviorally it can be improved. If you are doing yoga, you may be having controlled blood pressure, and you may be helping you in anger management. You are not that angry as Albert Pinto is. So indigenous therapies, even the writings and the scriptures, if you look at. But the problem is how to do it with the client. There are many dictums, many statements of the great people. Number of things you will find. Vivekananda said this, Mahatma Gandhi that says. But how to interpret and bring it into the day-to-day life, that's very important. Now this casework is not a one-time process that somebody came and he explained the problem and the problem is over. It is a long term, it may be a long term exercise, require 5 sittings, 10 sittings, 15 sittings. It may also require the other component, not only interviewing, home visit, talking to the family members. So its area is quite wide. It's not limited. It's not one-to-one. It is one-to-one as a method, but it may invite other things also. And that is what very important when we have to take care of. Because our purpose is to help the person who has a problem, who came to us with a problem, and we have to, as a social worker, help him in restoring back his social functioning. And for that, if I require to talk to his friend, talk to his well-wisher, talk to his family members, that become the part of casework. So casework is not only one-to-one. One-to-one is that the person who came with the problem, he is with you. So I was talking of the Indian considerations. Still in India, many things like counseling is not considered a good word. Why should I go to anyone? That too professional counseling, to pay and get the counseling. Because in India, everybody is a counselor. You go to anyone, he will give you some suggestion. If you say, I have a headache, people will tell you 10 drugs. It is freely available. It is offered freely. But the type of counseling I am talking, it's more professional, by experienced people, by people who have been trained into that, and that makes a difference. So it will take time to get recognition. This profession as counseling, still counseling is not very well recognized, and people do believe in that, counseling do pays. Same way as the caseworker. Now many legislations have also recognized. We have a Family Court Act, and under the Family Court Act there is a legal provision to appointment of the counselors, family counselors, who will help to the family court in making a study and presenting the report and even making a counseling between that. HIV/AIDS program. We have a school social work where we ask that in a school there should be a social worker who helps to the student to make an interactive environment between him, family, peer group and school. But many schools do not appoint because we don't have even enough teachers to appoint, what to talk of the counselors. And when you talk to our political leaders, they say these are the Western concept. And I believe that if a concept, even if it is a Western, but if it is useful for the common man, it should be applied. So I believe that casework has that potential to resolve number of problems at the inception level, and can give a direction to a new person to lead a good life. I was talking of the indigenous therapies. So I talked about the yoga, even the scriptures which has been, they are full of stories. Creative literature can be used as a therapeutic method. Even media, even films, our commercial films, they can be used in molding the behavior of people. The only thing is that how to do that. Play therapy. Now there are too many therapies coming up, mud therapy and laughing therapy, there are. But I don't undermine, I'm not underscoring any therapy. I believe that all the therapies are developed and meant for the betterment of the human being. Whether it is a client-centered or it is a task-centered therapy, whatever it is, whether it is a psychodrama or whether it is a psychoanalytical therapy, whatever it may be, I believe that all these therapies are useful for. So coming back to the topic, what I tried to explain to you, that social casework is an important method where we have to work at individual. And why we have to work at individual? Because individual is the basic unit of the society. And everyone have interpersonal or intrapersonal problems. Now, interpersonal problems are more prone nowadays in this modernized world because we don't have friends. We don't have person to whom we don't have trust, we don't have relationships where we can seek. Our earlier institutions, they used to perform the role of this counseling, which is now by and large missing, like joint family system, like parents, like in many relations, your brother, your bhabis, and now those relationships are missing by virtue of this faster industrialization and urbanization. You don't have. People don't have a shoulder where they can keep their head and beat. So what is the option available? The available option is that you have to go back, you have to professionally buy that expertise which is required. And social work coming out of the humanitarian concern and born out of the concern of resolving the problem and crisis of the people, it offers through its one unique method of working with individual directly to the people. So this method is very important. Another thing is this, that in today's modern world, everyone is suffering with the problem of stress. Now from where this stress is coming? This stress is also emerging out of the failure of relationship. And I call it that we are living in a society where there is a crisis of relationship. And रिश्ते हंसते नहीं हैं, रिश्ते रिस रहे हैं, और जब रिश्ते रिश्ते हैं तो टीस देते हैं. So I believe that such kind of a method of working with people are very important, and the students of social work, they must experiment, they must enjoy, they must learn the art of working with the people, and it doesn't come in a day. It requires rigorous training and understanding. And in that process, you also resolve your own many problems. So the approaches like transference and counter-transference, when we talk into the social casework, comes to the picture. It is not that caseworker is a perfect human being. He himself has many problems, or she herself has problems. But in this process of doing, you are benefited. So finally, friends, my advice to you, there are good reference books. There is a book by Perlman you can read. There is a book by Hollis on social casework. In Indian context, there is a book by Grace Matthew on social casework. There is a book by R.K. Upadhyay. There are many case records available into the different libraries. Good number of books. You can also read the books on the psychology, especially if you read on the developmental psychology, that will help you, like Harlock. So I just gave you few names which you can touch upon, and the books on various kind of therapies. In last, since there is not much time left, I will just advise you that have this faith into the method, and when you apply this method with the faith, with the conviction, with the commitment, uh, with the creativity, it will definitely give you the one of the best results.
Okay, as you said that, the ego, people defend the ego, but as the Sudhir Kakkar, Friedman, what they say, the id and superego is the higher level of the expectation which people have. Yeah, the society puts on the individuals, and ego is their personal need, a personal desire, personal expectation. So, what the ego does, as you were saying, that they balance the things. So, can we say that the growth of ego, yeah, maturation of ego is not proper? That's why people start defending the ego. Yeah, we need kind of system which helps in maturing the ego process. Yeah, what do you say?
We can say, though where I am not a very psychological expert, I am not expert in psychology, but what is my general understanding is that there are 3 stages of mind.
Okay.
And one, what we call it is a want, it is a generating desires, it is a demanding, it is a questioning, it says I want, and this is what I want is a very important. The other end of is that is a superego, and superego is a realistic, it is a moralist also, it
Yeah,
talks
we can say society wants.
yeah, it gives you approval and disapproval in terms of the society, and
Yeah.
so it is demanding, and and this ego has to keep a balancing force. And as soon as you learn to strengthen your ego, that's when you are learning to have your reasoning, realism, realistic analysis. That's when you will be able to convince both parts, the id and superego. You know, something says I have to do it, it says smoke, and when the moment I try to be smoke, my morality comes into the picture. No, I come from a family, nobody has smoked from last 100 years. How can I do? I will bring a bad name. In this dilemma, what I am doing, what I am losing, so strengthening ego may help you in resolving this problem. So ego is, and Freudian concept is a well-established concept, and many theories and many approaches are in and around it. So I think the question which you have raised, it is very important to understand these 2 components in order to strengthen the ego.
So, as you said that the fabric of society is falling apart, and you are suggesting the ways what the Western have adopted for resolving their problem or resolving their situation what they are facing nowadays. But India faces a different problem apart. So, adopting Western methods for solving the problem of India is a right way of going ahead. Yeah, we need method indigenization of the method also.
That becomes automatically, method or any kind of this is a knowledge, and knowledge is neither Western or nor Indian. Knowledge is for the betterment of the people and betterment of the society. So if we borrow that knowledge, if we take that knowledge, when we apply into the culture, the only caution is that it should be made it should be tailor made, and it should be culturally specific, so that it doesn't produce the counter effect.
Okay.
Otherwise it may produce another problem. So what I am trying to say that in last many years, even in India, these methods have been applied, and so there has been many modification into it, and many ways have come into it, because of the paucity of time I can't explain that how social case work in India, but it is equally recognized because it's a knowledge, and knowledge is always growing up. Of
Right.
course, it born into the Western land, but it has been used like many. I will name here the Gauri Rani Banerjee, one of the very known social work professional in Tata Institute of Social Sciences. She has used how the Gita, Ramayana, or the other scriptures, they can be used in the casework method.
Okay. So, well, friends, the things are changing, so we have to keep pace with the changing times, and the methods, the knowledge system is also evolving and coming up to our rescue. So we have to adopt, and we have come out with the problem what we face in day-to-day life. We have what the due to circumstances which is offering us. So with these words, we conclude the lecture. I thank all of you for watching the lecture, and on behalf, I thank Professor Sanjay Bhatt for giving such a wonderful lecture on this very topic. Thank you very much.